Chronic depression, again, is that dysthymia. Individuals can have dysthymia and also major depressive disorder, and that sometimes is referred to as a double depression. If you have double depression, dysthymia, with periods of full major depression, it does become more difficult to treat. Mostly because that individual does not have a frame of reference of what it feels like to not be depressed. So that can be difficult to treat. What you may have also noticed in the description for this workshop is that I was going to talk about how the DSM eliminated what was known as the bereavement exclusion. Bereavement exclusion. The reason that they eliminated the bereavement exclusion is because all of us knew to ignore that, basically. Because we know that a trigger can be a significant loss, be it of a significant other, be it a job, be it a lifestyle. So a significant loss which results in grief can trigger major depressive disorder. So officially now you can give the diagnosis of major depression if it started with a bereavement. It is important, though, to know the difference between a grief reaction and major depressive disorder, because we don't want to diagnose someone who is having a grief reaction with major depressive disorder. And the difference is that with grief, the painful feelings come in waves. They're intermixed with positive memories, and you've probably seen this. For example, if you've been unfortunate enough to attend a funeral, which most of us have, there are times when the bereaved person is able to talk about that individual and provide a funny story about them. They are still grieving and can still get easily tearful, but they can, in waves, have some positive feelings about that person. With major depression, that depression and the mood and the ideation is pretty much all the time. It is not something that's movable. With grief, self-esteem is usually preserved. It's not something that is generally affected by grief unless there's something else going on with that person's personality. With major depression, those feelings of worthlessness, self-loathing, etc., are consistent. Of course, we know that there's some form of sadness or depression that occurs as a result of the bereavement. It's only when the symptoms get severe enough and last a minimum of 2 weeks consistently with not moving and other symptoms join it that this person then is considered at risk for major depression or in a major depressive episode. So that is the elimination of the bereavement exclusion as we knew it. Typical course and causes of major depression. And again, when I'm talking about major depression today, I'm talking about the diagnosis, the medical diagnosis, major depressive disorder.